Good afternoon. Hello and welcome to St. Joseph's University Unlimited Learning Series. I am Tonya Lupinacci. I am an attorney and consultant here at St. Joseph's University Brand New Center for Addiction and Recovery Education and a doctorate student in our IDFL program, class of 2024. And it is my honor to host this very important and informative conversation about addiction and recovery in 2021 and beyond. I am joined today by two experts in this field who are also proud St. Joseph University alum, Steve Forzato, class of 2016, a graduate in Master's of Science, and director of our new care program here. And Dr. Joseph Garbely, a 1985 graduate and executive vice president of medical services and chief medical officer at Caron Treatment Centers. Welcome, gentlemen. Before we dive into today's topic, I want to just briefly thank St. Joseph's University for today's event and thank you all for joining. A key element of St. Joseph's University's mission is the commitment to lifelong learning. The mission led to the creation of the Unlimited Learning Series and today's interactive discussion on addiction and recovery in 2021 and beyond. Rates of addiction or substance use disorders and overdose continue to rise in the United States, impacting almost half of all American families today, according to a Pew 2017 survey. The country has been dealing with this health crisis in recent years, and as the opioid epidemic has taken hold, and now this health crisis has directly collided with another health crisis, COVID-19. In response to this, the country has been forced to deal with the addiction health crisis while balancing a global pandemic. Addiction and substance use disorders are complex, requiring the involvement of professionals and organizations, from health practitioners to nonprofits to decision makers and policymakers, to combat the many healthcare and societal issues tied to these conditions. So with that, and to get our conversation started here today, we are going to welcome all our attendees to take part in our anonymous poll question that will pop up on your screen momentarily. And as you are completing the poll, I just want to take this moment to thank all the attendees who submitted questions during registration. We will address some of these questions throughout the hour. And if you have any questions during the course of this webinar, please feel free to place them in the Q&A function below on your screen. Please include your name, location, and graduation year if you are an alum, and we will look forward to answering those questions here today if we have some time at the end. So we're going to wait for some of these results to come in. Should be great. Okay. So the question was, which of the following best describes your professional background? And it seems that we have attendees from many different areas in the field: medical, legal, law enforcement, criminal justice. We have about 36% of attendees from that area. Social work, education, 14%, social work, human services, 11%, nonprofits, 11%, business, and medical and others. So we have a nice variety across the board here, and welcome to everyone. Okay, so let's get our discussion started with our wonderful experts here today. Dr. Garbely and Steele, before the pandemic hit, there appeared to be a real focus and effort in addressing addiction and recovery in the country. It was being discussed in the media, decision makers across healthcare, government, law enforcement, and education were addressing it. Can you explain to our audience a little bit more about the state of affairs where we were with regards to addiction and recovery before the pandemic hit? And I'll start off with Dr. Garbely. We can start off with you.
Thank you, Tonya. I just want to say it's an honor and a privilege to be part of this unlimited learning series. And St. Joseph's given me and my family so much. I'm just happy to give a little bit back. But what I would say is that we were having a national conversation. I've been an ASAM board member and I've been in charge of physician training for the country for 2 years. I just got renewed for 2 more years. And before the pandemic, the conversation was leading us to some solutions, namely in how we prescribe opioid analgesics as physicians. The PDMP in every state and the communication between PDMPs in every state really helped us stop doctor shopping and really helped us understand who was outside the margins from a physician point of view around prescribing. And we were able to get a handle on it, and we saw a decrease over time during this national conversation in opioid analgesic prescribing. Because it's in that prescribing that we introduced a generation of folks to heroin and later to synthetic opioids, which drove this epidemic in opioid overdoses so high. Obviously, since the pandemic, we've had 2 epidemics that are hidden within that pandemic. And that is, one is substance use disorder increases and also mental health destabilization. So those 2 epidemics have been sort of hidden, if you will, in a pandemic, that is COVID-19. And isolation is the reason for all of that. We are very social as a group of humans. And when we are stuck isolating, we tend to decompensate from a mental health point of view. And the use of substances, while they are often for reward, sometimes they're for relief. And a lot of people are using substances to relieve their mental health degeneration.
Great, thank you. Steve, I know you spent years in law enforcement and are committed to what we're doing here for recovery at St. Joseph's University. I'm curious to know, what you think about where we were before the pandemic, and also to follow up on that, as Dr. Garbely had mentioned, the PDMP. I know that is a great tool that we are using, not just, I think, in the medical profession, but also in other professions that have access to that tool. So can you explain to the audience a little bit about that and how it's useful?
Thank you, Tonya, for that question. In the United States, we are facing something that we have never faced before, a trending increase in fatal drug overdoses that's far surpassed anything in our history. And so in 2019 alone, 70,000 Americans died from fatal drug overdoses. And that's more than 191 per day. In Pennsylvania, just this past year, according to statistics from December of 2020, more than 4,458 Pennsylvanians died from fatal drug overdoses. That's 12 a day, Tonya. And so, again, we are facing a problem that 20 years ago, 30 years ago, when people were using drugs recreationally, self-medication, and so forth, those generations did not experience what this generation is experiencing today. And I think it's important to put that in perspective. And because of that, certain influencers in our government and in our society have made critical decisions, certainly before the COVID pandemic. And included among those are the Pennsylvania Governor Wolf, Attorney General Shapiro, where the Pennsylvania governor declared fatal drug overdoses a public health emergency. And by doing that several years ago, it rallied all of the state agencies together, Department of Health, Department of Drug and Alcohol Programs, but really every state agency. And we used to meet every Monday morning in Harrisburg and talk about what should we do? What can we do to address the rising numbers of fatal drug overdoses in Pennsylvania? And so, Tonya, COVID hit in March of last year, but thankfully the plans were laid and program developments were really rolled out well. And so I got to witness that in Harrisburg, and I can't tell you how important those programs are. Naloxone distribution, that life-saving medication that is so critical for opioid overdoses, is really all around Pennsylvania now. First responders, police, fire, EMS are all carrying it, and even family members are carrying it. Last year, more than 50% of the overdoses in Pennsylvania occurred within the decedent's home. And so it's really critical for naloxone not only to go into the hands of those of you on the front lines of the opioid crisis, and I think particularly of our law enforcement audience, as well as EMS and fire, but also it go into the hands of loved ones. And so that critical decision years ago for the Pennsylvania Secretary of Health to write a prescription for naloxone so that anyone can walk into a pharmacy and obtain it was so important, because again, people are dying, Joe, they're dying alone. They're dying within family groups or loved ones that could possibly come in and help.
Great, thank you, Steve. Dr. Garbely, Steve had mentioned naloxone. We know it's a life-saving drug, and Pennsylvania does still have and currently has and will hopefully remain to have a standing statewide prescription for that drug. How does that help families who may need access to the drug, and how is, from what you can see in the treatment arena, how is that assisted with recovery?
So it cannot treat the disease. We must have reversal measures like naloxone available, not only to someone who is in the throes of addiction, but the family members that may encounter an overdose. Here at Caron, what we do is we give 2 naloxone syringes that are used intranasally, and we teach the patient and their family, their designated family member, how to use it. And the family member carries it on their person, as does the person that we've been treating. So it's really important to have that at your disposal when you need it. And Steve's efforts and his group at CARE have been unbelievable in training first responders to also understand the importance of the use of naloxone. And what Dr. Levine did is, by writing that prescription, made naloxone accessible to families that are going through the throes of addiction with a loved one. So that reversal medication is so important to get someone into treatment so that maybe we can turn the tide, if you will, of their addiction.
It really is tremendous. As Steve had referenced, that we have a solid foundation. Before the pandemic hit, we have a plan and a structure so that individuals have access and families have information access. Along those lines, Dr. Garbely, and then I'm going to ask Steve the same question. COVID hit, all of our lives were quite literally turned upside down. How has Caron and other treatment centers pivoted to respond to the pandemic and still provide access and treatment to those in need?
So here at Caron, we had to put in place measures to make sure that our patients are safe and our staff are safe. So the first patients were identified here in Pennsylvania on March the 6th. On March the 6th, we began the process of screening people before they come in. We began the process of surveilling patients once they are here, twice a day, every day. And we also began the process of screening our staff that are patient-facing as well. So we had an intentional decrease in census while we put these measures in place. And then since then, we've seen now record census here in Pennsylvania. We are at the highest level we've ever been. We've been around since 1957. Our census today is the highest it's ever been, because we've proven that we can keep people safe, both staff and patients safe. So that was one thing that had to happen on the residential side. On the non-residential side, which is our outpatient programs, we converted to telemedicine. So virtual visits is where we landed in all of our outpatient settings. We now have a bit of a hybrid since we got the safety measures in place, but mostly we're still doing telemedicine with very good attendance, I might add, as a follow-up to residential care, or it could be initial care if their addiction hasn't progressed to the level of needing the highest level of care, which is residential.
And before I go to Steve, I'm curious, Doctor, was that a real concern before implementing the telemedicine measure? Were you concerned that patients were not going to connect and really needed that face-to-face interaction for treatment?
We were, very much so, but it was necessary to do so, to make that switch over to virtual care. And what we found is that actually we've had increased attendance. Folks are happy that they can join us from the privacy of their own home and not have to drive into a bricks and mortar outpatient facility. We have many outpatient facilities up and down the East Coast, and each of them has enjoyed an increased attendance as a result of the virtual offerings we have.
Oh, that's great to hear. Just hearing hope there and that there's an increased attendance is fantastic. Steve, I know the great work that you and your team at the Center for Addiction and Recovery Education is doing. How has CARE pivoted in response to the pandemic with providing the services that your department provides?
Sure. Thank you for that question. So we had big dreams when we started in October of 2019. Department of Health approached us and we started to have discussions about training first responders around Pennsylvania. And so our first training was right here at St. Joseph's University, where we trained public safety. We have 70 public safety officers. We trained and equipped them with Narcan, but also trained them on the causes of addiction and the fact that it's a treatable disease, that there is hope. We talked about stigma. We talked about how to connect people to treatment. And so that sort of developed into a Department of Health funded program where they asked us to train all of Pennsylvania's first responders. So police, fire, EMS, all those related professions that are out there in Pennsylvania that are on the front lines of the opioid epidemic. Many of those in our audience today fit that description. And so we were asked to train a 4-hour training for these individuals. And I had big plans, Tonya, to do it face-to-face with a group of trainers, police, fire, EMS, some of whom are in recovery themselves. So they have a lived experience. They understand how hard it is for recovery, and they have found success in it. However, because of COVID, we had to pivot more to an online offering. And so we had to go virtual with a lot of the trainings. Now that numbers are slightly decreasing and there's some hope, some of the audiences have invited us in and we wear masks, we social distance, and we train in rooms as well as virtual. So we had to pivot just like universities had to pivot and Caron Treatment Center had to pivot to more of a virtual offering for some of the services, the same with CARE.
Great. And what else, is there anything else, I know there is, but is there anything else with regards to the new Center for Addiction and Recovery Education that's unique, that's one of the kind here at St. Joseph's?
Absolutely. Sure. So St. Joseph's University has taken substance use disorder very seriously. And so we, of course, talk about care for the whole person as part of our motto. And we want to give people, students here, a full college experience and non-judgmental college experience. And so St. Joe's has traditionally been non-judgmental and not stigmatized towards things like substance use disorder, but we really ramp that up and put our money where our mouth is. And so I'll show you a photograph. This is our recovery house. We started this through the generous donations of individuals that believe in this addressing substance use disorder, particularly among college students. And so St. Joe's offered this particular place. Look at that. That is not some building that's, on the side of campus that's dilapidated. This is a beautiful building at St. Joe's, can hold up to 20 students and that are in recovery. Now, these are individuals that found success in treatment for alcohol dependency, drug dependency, other drug dependency, and they elect to live together and have that support with a drug and alcohol counselor and a residence hall manager in recovery himself, who really understands how to bring support to this community. And so again, this is an important step forward for St. Joe's. We're one of 40 in the nation, 40 universities in the nation that have a recovery house on campus. And we are the one in this area, one of, there aren't any on campus type of recovery houses in our immediate vicinity here. So we're excited about it, but again, it highlights the importance of higher education to address substance use disorder and understand that it is a treatable disease and people do recover. And as a friend of mine said, they become better than well. I could tell you people in recovery, Tonya, they are some of the strongest people that I know. They are the most interesting people I know, and they have been very successful by finding the strength to recover from a substance use disorder. They have a great family life, they have a great career, and so I find that St. Joe's is providing that opportunity for its students.
Fantastic. Dr. Garbely, let me ask you along those lines. Steve had talked about the recovery house that's on campus for students. Why is that so important for a student between the ages of 18 and 21, 22 years old, let's say, who's a current student or maybe a graduate student? Why is it important to have such a recovery facility right there on campus for them? Why would that be important?
I want to just say, Tonya, thank you for the question. I just want to applaud Steve and CARE for getting the recovery house up and running. You know, I've been a consultant through the external advisory board of CARE and so proud to be part of that. And I'm just so proud of what St. Joe's is doing. The importance is that it's a safe haven. You want to be with like-minded other students who are living recovery with you. And that's what recovering people do all the time. Everyone who is in recovery helps each other. And if you have a place for them to live and help each other and live by the tenets of recovery, that resiliency that Steve was talking about is seen with everyone. And it's just a much safer environment for them. As you know, college is a time of experimentation. So to be in a place where that's not happening, where you're around people that are in active and progressive recovery, is a safety measure for them. It's a safety measure for their family as well. They feel comfortable putting their child in a sober residence rather than on campus where possibly the recovery of that particular student is in question or at risk with experimentation.
Well, I think this will be a good time to take a moment here and pause for our second anonymous poll. So we are going to present our second poll that you will see momentarily on your screen. If you could take a moment to answer that question. And Steve, as we're waiting for the results to come in, you had spent years in law enforcement. Now you're here at St. Joseph's University as the director of the care department. And you have seen over the course of your long career and experiences how substance use disorder has affected so many people. Can you just talk to the audience a little bit as we're waiting for these poll results to come in and talk a little bit about, for those who may not know, about addiction, substance use disorder, and how it affects our communities and our neighborhoods and just different aspects of our life?
Absolutely. So statistics show that substance use disorder affects more than half of Americans. And so half of our audience today, certainly half of our alumni at St. Joe's, half of our community is being affected by it. And about 10 or 11% of our society are afflicted with substance use disorder themselves. So that's an important thing to remember, because whenever we discuss, addiction, half of the people that we're talking to know that firsthand. They know it personally, and it has affected them. These stories, these accounts of families, good moms and dads, good family structures that have lost a son or daughter to addiction, are just heart-wrenching. And it was heart-wrenching for me as a law enforcement officer to meet a family that lost a loved one to an overdose. And I know it's been hard for many in the audience, regardless of their profession, and struggle to understand, why do people continue to use a harmful substance despite knowing they could die from it? And that question brings out an important point about addiction. And why do people continue to use? And thankfully, we're able to share that answer with first responders throughout Pennsylvania. And the brain science behind chemical dependency is very interesting. And quite frankly, I wish I understood it, long before, when I started my law enforcement career. And so I grapple, like many, to understand why bad things happen to good people. But again, we just have to tackle this issue head on.
And Dr. Garbely, I like to, along those lines, ask you, as we know from the Pew survey, almost half of our families here in this country are affected in one way or another by substance use disorder. I know from my experience as a former prosecutor and now studying this area and assisting with the Center for Addiction Recovery Education, what I learned is it really takes a comprehensive approach, long-term comprehensive approach. There is no quick fix. Could you elaborate a little bit about what it really takes to get someone through this?
Thank you, Tonya. Excellent question. So it's important to understand that this is a chronic brain disease. It's a stress-induced primary chronic brain disease of certain circuits of the brain being affected, memory, motivation, and reward circuitry primarily, but the manifestations, biological, psychological, social, and spiritual, and it leads to the pathological pursuit of substances for reward or relief. So that's what we understand about addiction now. And we have to treat it like a chronic disease and treat it with a chronic disease model, like we do with hypertension, diabetes, coronary artery disease, MS, for instance. We would never debate these as chronic diseases, yet we still want to say that this is a moral failing or lack of willpower, even today, even though the science is incontrovertible about this being a chronic brain disease. It's actually the second most preventable chronic disease that's out there. So if we can treat this from a long-term approach, we will have much better success. Dr. John Kelly, who's a psychologist at Harvard and part of our professional advisory council here at Caron and a dear friend, has done great research showing that it takes about 1 year for relapse to be less likely than recovery. 1 year. And in 5 years, you will have the same risk factors as someone who has to have the disease of addiction. In other words, your risk of relapse is similar to the general population's risk, as Steve mentioned, 10 to 11% of manifesting the disease of addiction. So it's important that we change the paradigm, because we had this idea that if we put someone in treatment for 28 days, then they'll be fine. Well, that's not true. We have to treat them for life. And that's our model here at Caron.
Great. And Steve, let me turn this question over to you. Dr. Garbely had talked about changing the paradigm. It's a lifelong commitment. And can you talk a little bit how it is really imperative and it's so important for lack of a better word, to have all hands on deck from different aspects, whereas decision makers, healthcare, medical, government, law enforcement. Why is that important in addressing this issue?
Well, we just had to look at history, Tonya. You know, for decades, for probably close to 80 to 100 years, we thought that law enforcement could solve all of this drug problem. And so what we have learned because of the upward trend of overdose deaths, that despite the great efforts, the courageous efforts of law enforcement, the idea, the probability of cutting off the supply of dangerous substances in our community is very low. The likelihood of success with that is very low. That doesn't sort of undermine the importance of the work of law enforcement. Just yesterday in Bucks County, $4 million worth of cocaine, fentanyl, and heroin were seized by law enforcement. And there's nobody else to do that. And so we don't have drug and alcohol counselors or public health people going out and seizing these lethal supplies. We have law enforcement doing that. So I do support that work greatly. But it takes a multidisciplinary approach to address this drug crisis and to get those numbers to trend down. And so, you know, not just law enforcement, but it's got to incorporate public health, and they are fully engaged in Pennsylvania and nationwide as well. It also, education and prevention efforts are critically important, as well as stepping up treatment to make it evidence-based, like Caron Treatment Center. You know, all treatment centers need to make sure that what they're doing is working, as well as recovery support system, giving greater access to people in recovery to that support system in their area, in their region. And so it's a multidisciplinary approach. I learned, Tonya, as I think you did, we just can't arrest our way out of this crisis, can we?
No, we cannot. All hands on deck. And it's really proud of the work of law enforcement around the state and around the country, because there is a real focus and effort in addressing this in multiple ways. So with that, I want to turn towards prevention. Steve, you had mentioned that. You know, practitioners, psychologists, researchers, educators, and policymakers are working, as you know, to battle this epidemic, and in light of COVID as well. So I want to talk a little bit about the prevention measures that are being implemented, that you would like to see being implemented. And I know this is a long worded question, but I would like to kind of break it down, first starting with what can parents do? What can parents and teachers do to implement some prevention measures for our youth? To prevent them from going down toward addiction. So I'll start there. Dr. Garbely?
Sure. We have invested heavily in prevention through our student assistance program. We're in 1,000 schools up and down the East Coast. These are elementary schools, middle schools, and high schools. And the idea with this is that they're in those schools to teach about what can happen if you begin a process of addiction and what addiction's all about. So in other words, educate young minds about what addiction is about and the perils really that can happen if indeed you go on to have the full-blown addiction. And we're able to catch this early and intervene early. The screening, brief intervention, and referral to treatment model that the federal government came up with through SAMHSA has really been very helpful in looking at at-risk youth who are perhaps not identifying as a fully codified substance use disorder, but have harmful or hazardous use patterns. And we want to intervene early, just like we do with other chronic diseases, so that we can stop the inevitable progression to a fully codified substance use disorder. So we must begin the conversations with our children and also in the schools through help with professionals that understand the language and understand the science and can identify harmful and hazardous use patterns.
Yes, absolutely agree. And it's not just one conversation, you know, on a day that's designated, let's say, to talk about it. It's a conversation that needs to happen all the time. Steve, I'd like to ask you that same question. I know that you've been involved in your career by going out to some schools and speaking to parents too in your law enforcement career, which I'm sure that was a very difficult conversation to have with them in certain instances. But I also know that you had participated in outreach programs in schools. How important is it, and what type of preventive measures would you like to see implemented with our youth?
Absolutely. So prevention measures themselves, prevention programs are critically important. Back when I was in high school and middle school, we would have an occasional, every other year, every couple of years, someone come in and talk about drugs and alcohol and why you should be careful and consider not using. And sometimes they were dynamic, sometimes they were boring. But remember, back then in the 70s and the 80s, 1980s, it was preventing people from essentially ruining their life, not being able to get through school, not being able to get a college education because of substance use, or not having a great career, or just not having a great family life. And so these prevention measures were important, critically important for people to have a full life, but it's different now. I mean, we are actually interested in prevention now to prevent death. And so we need to step up our programming. I believe just like treatment centers, recovery groups, all should be evidence-based. In other words, they should be able to prove that what they're doing is effective. It is critically important that prevention programs be studied and researched so that the message that they are giving is not only resonating with the audience, but it is effectively reducing the numbers of people who are using substances in a harmful way. And so again, prevention is critically important. I think in our area and in Pennsylvania in general, we should step that up a lot more because we are again facing not a crisis where someone could just simply be less successful. They could actually not survive. And so if we can prevent, Tonya, first use of an opioid or use beyond medical necessity, we will save a lot of lives.
Yes, absolutely. Dr. Garbely, along those lines, can you talk about the preventative measures that can be used for those who may be experiencing active addiction and those who may be in recovery? Because I'm sure it's a little bit different from, talking to those kids or youth before they go down that road. So I'm curious about what measures can be used for those who are currently suffering.
Suffering from addiction, Tonya, is that what you're saying?
Yes.
So if we do identify someone who is suffering from the disease of addiction, we have to figure out what level of care would be the most appropriate for entry into treatment. Understanding that this is going to be a chronic disease model of treatment. So we have to figure out, using the tools that are in front of us, what is the level of care that would be most appropriate for this young person? It could be general outpatient, it could be intensive outpatient, it could be a partial hospitalization program, or it could be residential, which we have here on our campus in Wernersville. We have a teen program here that is always full. And we also have a young adult program that's always full. And the reason for that is that we really try to meet the person where they're at and make sure that they're around people their own age that have the same experiences that they're having in their addiction and in life in general, so that they will do better around their peers rather than be in a mixed group of multiple ages where they may not have anything in common with those other folks in treatment. So we have made a decided effort here to make sure that we get treatment started at the right level, first and foremost, and secondly, around the right peers, the people of their generation that are going through very similar things, so that they can help one another.
Great, that's great. I want to talk a little bit about other industries outside of treatment and perhaps outside of what we're doing here at St. Joseph's. And there's many people on this call that had indicated they're from education, university, business, and other. So what can other industries outside of the treatment arena, what can they do? How can they play a role in addressing substance use disorders? Steve, we'll start off with you.
Sure. So as I mentioned, half of Americans are affected by substance use disorder. So it would not be unusual if we were to be able to research a particular company, a business, and poll their workers and got an appropriate, truthful response. Half of the employees of any company will be affected by substance use disorder. And so that means they are bringing to their workplace the stress of dealing with a loved one that is struggling with substance use disorder, or they themselves are struggling. And so employee wellness programming in businesses is critically important. That employers want to retain their best and their trained employees, and to simply just get rid of somebody because they exhibit the signs and symptoms of substance use disorder, rather than trying to help and clarify exactly what's going on, to either help with their own treatment, their own use, or to help them cope with their family loved ones, I think is critically important for businesses to consider. And so, so not only do I support employee wellness programs, but I really do support companies putting on programming to let their employees know, hey, we know about what's facing you and your family today, and we care about you. So let us spend just a little bit of time teaching about the signs of addiction, but also that is a treatable disease and how to connect your loved one to treatment. I think that would be a great model for businesses to take on, to again, make their employees feel like they're part of a family.
And before I go to Dr. Garbely on this question, I just want to follow up with one thing. CARE, as you know, is for first responders, educating them and connecting assisting them to connect people to treatment. But it also includes, under the umbrella, related professions. Do you see a potential here to expand past the first responders, so to speak, and try to bring this great program to other industries?
Absolutely. While training first responders, I heard from first responders themselves, wouldn't it be great if you could just train the public? There's a lot of moms and dads that do not understand the brain science behind addiction. They do not understand how to connect people to treatment. And so, so it's opened my eyes that this program that we piloted, training first responders, is perhaps just that, a pilot that could be scalable and open to other parts of our community. And so, yeah, I dream about that. The elected officials, the public elects officials, legislators, county commissioners, township supervisors, because they want those people to address the problems in their community. And so again, half of our community is affected by substance use disorder. So wouldn't it be wonderful to train, those group of influencers in our society? So yeah, Tonya, we are really focused on first responders. They are always on the front lines. They're the ones that engage people in active addiction, mostly at the worst time of their life. And so, when they're overdosed or when they engage with the criminal justice system as a result of addiction, or medical calls to residences. So again, that is a primary focus of ours, but we are not going to ignore the rest of society.
Okay, great. And one more question. I'm going to turn it over to you, Dr. Garbely, before I open the floor up to both of you for some final remarks. But Dr. Garbely, what are your thoughts on how other industries could play a role in understanding substance use disorder and play a role in helping people get the treatment that they need?
So thank you for that question. Excellent answer too, Steve. We are trying to be part of the solution here at Caron. My CEO and I have talked to many CEOs in Chicago, in Florida, in Washington, D.C., because they're hungry for knowledge about the neurobiology of addiction, and they want to understand it better because what they're experiencing is, if someone's in active addiction, it's absenteeism and performance issues. But for the lion's share of folks that are affected by the disease of addiction, it's presenteeism. So they are there, but they are worried about their son, their daughter, their wife, or their husband, or they're dealing with issues on a real-time basis because someone in their family, immediate family that is suffering from the disease of addiction. So we have record attendance when we do talk to these CEOs because they really want to get a handle on this at work, because work's a place where you can really educate and you can intervene if necessary in a way that can get them help. And that's what we talk to them about, that this is a preventable, the second most preventable chronic disease that's out there. And it's really important to identify it early and avail treatment to them, to your workers, and also help workers if their family is in the throes of addiction, help their family get into treatment. It just changes everything. Like Steve said, when someone's in recovery, they become great citizens. Their resiliency, their ability to deal with life on life's terms is beyond the pale. It's beyond anything we can measure. So it's important to give them the chance to get into recovery, or give their family member the chance to get into recovery.
Fantastic. We are going to post another poll up here for our audience as we come down to the wire and concluding our webinar here today. But as we do that, as the audience completes this final poll, I would like to give our expert presenters a opportunity for some final remarks. Steve?
Well, so Tonya, being in law enforcement for 33 years, and you yourself being a prosecutor for well more than a decade, it's just amazing the experiences that we've had when it comes to drugs and alcohol. And so when I look at the statistics, and I shared a little bit of them with you today, they're pretty grim. And some of the experiences that we had are pretty grim. Family members that lost loved ones, individuals that really need treatment, but refuse treatment, and unfortunately, waited too long. And so, rather than be grim at the end, I want to share something that is authentic with me, and that is I believe there's hope. And so I have seen lives turn around. I've seen individuals who lived on the streets of Kensington who were using 2, 3, 4 bundles of heroin a day. Yes, that much, and overdosing many, many times. And yet they finally decide, okay, it's time that I really do want to get help. And they find a good treatment center, they get help, and they're in long-term recovery. There is hope. Substance use disorder, whether it's alcohol or other chemicals, is a treatable disease. There actually is hope. It does not have to be terminal every single time. And so I applaud the work that Dr. Garbely does at Caron, all of those ethical treatment centers that are out there doing incredible work. I applaud their work. And I just want our audience to know that despite what you may be facing in your own life or your family's life, it is a treatable disease. You can recover and you can live a very good and healthy life after addiction. And
hope is one part of the recovery, and we all need that for sure. Dr. Garbely, final remarks?
So I love what Steve had to say. This is a preventable chronic disease of the brain, and if we apply a chronic disease model, people do get better and stay better. We follow all of our patients for at least 1 year after they leave here. And we help them continue their journey of recovery. Our relapse rate is less than 20% at 1 year. So this is a treatable disease if it's done right. If you use evidence-based practices and you use a chronic disease model of treatment, this disease can be successfully treated, just like Steve said. So it's important that we understand that this is not a hopeless cause. There's tremendous hope in treating addiction if you do it right.
Fantastic. Well, we have a very special guest, and I'm going to present him to everyone in just a moment. But before I do, I just want to let everyone know that this session was recorded, and you can find it on the university website, where you can also find information about upcoming sessions of Unlimited Learning, including one coming up in March titled Faith in Uncertain Times, featuring Father Dan Joyce and Rabbi Abraham Skorka. But I just want to give a few minutes and turn it over to our special guest, who I am thrilled to present to everybody. He's our founding donor and chairman of the advisory board for St. Joseph's University Center for Addiction and Recovery Education, Brian Dooner, class of 1983, who would like to offer some closing remarks. Mr. Dooner?
Thanks, Tonya. Thanks for hosting this event. And Joe and Steve, nice job. And to the folks of you listening, I want to say thank you for your participation. My wife and I funded the startup of CARE, and it was sort of a glimmer in my eye 4 years ago. And it's wonderful to see it take have made such progress and to take shape like it has. And I want to thank Steve and Megan Burke for their work on CARE day to day. When we started it, and I think to this day, the vision was to raise awareness and understanding of addiction and reduce its impact across society. But I even distilled that down further as I started to talk to people. It's really about leading the conversation. And St. Joseph's University has really stepped up. So everybody on the call here who is a proud Hawk should be doubly proud that your university sort of met the challenge that I posed to it, which is, will you take up this issue and address it, especially in our region? And they did. And that is a big step for a university to take. And so I couldn't be more grateful to St. Joe's for allowing all this to take place. Money is only a part of this, guys. For any of you who are alums, it's about getting and staying involved in causes that you care about. And if you can do it through your university, which is what I've been able to do here, it's awesome. So I couldn't be more pleased with where we are at this point in time, but I can't resist also mentioning that this is a lot more than law enforcement and first responders. But yes, indeed, this is a wonderful first accomplishment for St. Joe's to be involved in a sizable grant that helps so many people and carries our message and our brand and our desire to help make social impact out into the world. So it's just really awesome. So thanks for letting me say those few words. And Joe, Steve, Tonya, thanks for doing this today.
Thanks, Brian.
Absolutely. It has been my pleasure. And I really do feel in all our different backgrounds and where we come from and our perspectives and our understanding and where we go from here will save lives. So thank you so much for joining me and Mr. Garbely and Dr. Garbely, excuse me, and Steve Forzato and Mr. Dooner. And thank you to the tremendous staff at St. Joseph's University for presenting this session today. Great. I actually think we may have a few minutes for a few questions, and we can do that as we end today's session. Megan, do we have any questions that have come in that we would like to present to our experts?
Sure thing. We did get a question at the top of the hour about law enforcement, saying law enforcement is already overwhelmed with everything they have to do. Is it realistic to ask them to distribute naloxone and provide education in the community?
Steve, why don't you take that one?
Yeah, so law enforcement does have a lot of responsibility. They have stresses that most of the public are just not aware of. The level of training that police officers are getting gives little time for additional training on other topics. But I would liken it to CPR training and first aid. I was around when CPR and first aid was first introduced to law enforcement. And quite frankly, we all complained. We thought, why would we want to put our mouths on a stranger's mouth and breathe air into their lungs? And so the next year, the following year, from that first initiation of training, the trainer said, you may want to use this at home. You may have an opportunity to save a life at home. And all of a sudden, we all listened. It's the same way with training on substance use disorder, connection to treatment. When it becomes personal to us, we listen even more. And so it is personal to us. Half of Americans, including our law enforcement families affected by substance use disorder, and therefore we do take it seriously. And so saving lives is why we took the oath of office. And so saving lives is part of addressing the critical fatal drug overdose rate that we're seeing today. And so it's part of the job for first responders to save lives. And I think, and I know for a fact, it must be done. Law enforcement will grasp a hold of carrying naloxone, using it, but also being compassionate and connecting people to treatment, because it's what we do.
Great. Megan, do we have another question for Dr. Garbely?
Sure, just in maybe the last few minutes here. We had a couple of questions just wanting to get at some statistics or information regarding relapses. People have good feelings about starting treatment, but have, concerns about what the relapse landscape might look like.
So like every chronic disease, the relapse rate is significant overall. It's 40 to 50%. So it's a sort of it's a flip of a coin. But again, I think that if you use evidence-based practices and treat this in a chronic disease lifetime model, you can have better results than that. So relapse should not induce shame. So the difference between guilt and shame is guilt, I did something wrong. Shame is, I am wrong, I am bad. And we don't want that to be the paradigm that they experience. What we want is that if they do have a relapse, that they get to us before it progresses too far or to the point where they're overdosing. So again, we just have to re-educate the public that this is a chronic brain disease and relapse is part of it. So it's relapsing and remitting like every chronic disease is. And we can reduce the relapse rates if we approach this in an evidence-based way over a lifetime.
Great, fantastic. There are many other questions I know our audience had, and I am thrilled to let everyone know that you will be receiving an email from St. Joseph's University with the contact information for Dr. Garbely and Mr. Steve Forzato, and you are free to contact them and follow up with some additional questions, but I think many of those questions have been answered with this fantastic presentation. Dr. Garbely, thank you. Steve, thank you. And with that, we are going to conclude our conversation today. Again, I am your host, Tonya Lupinacci. Be safe and be well.